have a very fruitful discussion, and I'll try my best to summarize everything because there are a lot of things that we went through. Okay, first off, our group want to reinforce that there is lots of difference between community and institution intact, cognitively intact and cognitively impaired older persons. And for prevention and intervention efforts, we suggest that the training need to target staff at all levels, clinical and non-clinical. And special attention need to pay to case management and the transition of care, for example, from hospital to homes. And we should reinforce the use of a team approach and integrated partnership among different disciplines. There's also suggestion that we need to change. We need a change in curriculum for different disciplines, reinforcing a gerontology case management approach, and incorporate elder abuse training in the curriculum. And then we need to manage the expectation and inform people about their choices. For example, we should promote the use of advanced directives, guardianship, and encourage patient self-determination and enable use of health surrogates. And the Medicare visits, pharmacists in the community, dentists, etc. They will all be very good points of interventions to help identify cases. And we also recommend education for children and young people. Especially we should help out children that were, people that were traumatized by domestic violence because many of them turned abusers for elder abuse. And addressing these individuals would help prevent elder abuse. And our group also want to reinforce the idea that in nursing homes, a lot of the violence cases are resident to resident violence. So increasing staff ratio, changing the environment would decrease those elder abuse cases. And community integration that facilitate connectedness of individuals in a community would have multiple benefits. For example, improving mobility, decreasing poverty and isolation, which in turn could prevent elder abuse. And then we also talked about the use of information technology that on one hand it helps improving people's quality of life and help us take care of the older persons better. But on the other hand, use of internet, someone mentioned Amazon and Skype, right? Actually discourage people from going out and meet people for real. And then we want to emphasize that there are lots of quality nursing home care. And we should promote options counseling for older persons and their caregivers. And yes, and inform them of the continuum of care. So there is, apart from community care and nursing homes, there are daycares, respite care, etc. And then putting an older person in a nursing home does not necessarily mean that you fail as a caregiver. And then, again, we need to inform them of the quality nursing home care because lots of nursing homes are really good these days. And then colleagues also mentioned EHR, is it right? EMR as the point of prevention of elder abuse. So if I missed anything, I believe that colleagues would supplement afterwards.
That was fantastic. All right, we're on schedule. So the next domain that we're going to hear about is the breakout group that discussed the legal system. And it's my pleasure to introduce to you Mr. Charles Sabatino. He is the director of the American Bar Association's Commission on Law and Aging here in Washington, D.C., where he is responsible for the ABA's commission's research, project development, consultation, and education in the areas of health, long-term care, guardianship and capacity issues, surrogate decision-making, legal services delivery for the elderly, and professional ethics. Mr. Sabatino is also a part-time adjunct professor at Georgetown University Law Center.